Did you know that the way your child breathes may impact their teeth, jaw development, and overall oral health? Let's talk about how breathing issues may be affecting their smile and even their overall health. Breathing through the nose is how our bodies are designed to function. But when children develop chronic mouth breathing, it can lead to orthodontic and health concerns over time. When a child breathes through their mouth instead of their nose, it may cause narrow jaw development, leading to crowding and misalignment, an open bite or overbite as the tongue rests improperly, dry mouth, increasing the risk of cavities and gum disease, poor sleep quality, which can impact focus, growth, and overall health. The good news, early detection is key. Your orthodontist will assess breathing patterns, tongue posture, and jaw development as part of the comprehensive orthodontic evaluation. In some cases, simple interventions like orthodontic expanders, myofunctional therapy, or working with airway specialists can help improve breathing and prevent long-term dental issues. If your child snores, has difficulty breathing through their nose, or shows signs of mouth breathing, it may be affecting their dental development. Book a free consultation today and let's ensure they have the healthiest smile possible.